Hello, this is Diagnosis Bona Karatse Pole, and it's me, Dr. Dinara. Today I'm going to tell you about misdiagnosed condition, so let's get started. The number 10 is a pulmonary embolism. This is a condition when the clot is forming the blood tubes go up to the heart and after the heart to the lungs. And it can cause that this blockage can cause that some part of the lungs won't be supplied by the blood, and it can cause a condition which is called pulmonary infarction. So it could be just a little part or a very huge part of the lungs. So, and what symptoms could be? It's usually shortness of breath, cough. It could be a person is quite agitated. That's why how you can misdiagnose it. It could be just doctors can think it's just about like a panic attack or exacerbation of asthma or pneumonia. And there is also tried for pulmonary embolism, which is including a shortness of breath, a person coughed up blood, and also chest pain. When we can suspect this condition, when the person has this shortness of breath and some of the risk factors. For example, it's a prolonged immobilization due to surgery or long travel, or it could be due to a person is taking contraceptive pills, there is a cancer, or it could be because of that person has some blood problems like a high clotting. So, and how we can investigate this person? The first thing, when we see a chest pain, we do ECG, which can show that the right side of the heart is trying to pump this blood and to resolve this clot, which in some cases could be resolved by itself. We also do a D-dimer, which can also have a quite high sensitivity but low specificity. And the gold standard for this condition is a CTPE. It's a CT scan of the pulmonary arteries, which can show us that this clot in the lungs. So the number 9 is the celiac disease. This is autoimmune condition when the person is taking any gluten containing food like rye, barley, wheat, can cause the damage of the inner lining of the small intestine. If for kids, it could be a very classical presentation with a diarrhea, bloating, and failure to thrive. For adults, it could be really different presentations. Sometimes it could be a rash, which is called dermatitis herpetiformis, very itchy, looks like herpes. Sometimes it could be neurological changes, so it can cause a balance problems, coordination problems. Sometimes it even could be some reproductive problems. Women have a lot of miscarriages or infertility. And of course, if this inner lining of the small intestine is damaged, of course it can cause that nutrients don't get the blood. It causes conditions like anemia, so with not enough iron in the blood and other vitamins and minerals. So how we can diagnose this condition? Actually, it's not easy, especially if a person already read about this condition and they suspect that they have some like celiac disease. They are stopped taking any gluten food, and they are trying to do this test, celiac tests, which is not correct. At first, you have to take some gluten-containing products. Then, after some time, you have to do just this test. Then, if it's a positive, they will do a biopsy of the small intestine, of the lining of the small intestine. And if it shows that yes, there is a damage, this damage exists in this person, then you are starting to do this gluten-free diet. And after some time, they can check it again. So what can cause this celiac disease? Because of the not appropriate nutrients in your body, it can lead to very fragile bones, osteopenia, osteoporosis. As I told you about anemia, it could be B12 deficiency, folate deficiency. That's why it's very important to diagnose it and to have a strict diet. Number 8, adult ADHD. This condition, not about intellectual disability, this condition when the changes in the brain can lead to losing focus, some motivation, emotional response, working memory, and in male and female it's different. If it's a male, usually you can see they are quite active people, but hyperactive. But for women it could be just daydreaming, or they could be very disorganized. And all these changes can lead that in society they are trying very to be very productive, but it's usually leads to low self-esteem because they're thinking they are lazy people. Why they can't be concentrating on the tasks that they are like for hours and hours, but at the same time even simple laundry, paperwork, which can be take, for example, 15-30 minutes, makes them very anxious. So that's why all this stuff can ended up with burnout, with anxiety, depression, but actually they can see other specialists, especially that psychologists and psychiatrists that knows about this ADHD, how to diagnose it, how to treat it. There is no any blood test or CT scans that can show you this condition, but these specialists, psychologists and psychiatrists can help them. Number 7 is a hypothyroidism, which can mimic quite well other conditions because our thyroid is a butterfly-shaped gland on our neck, responsible for many processes in our body. And how can it start? With gaining weight, depression, fatigue, which can be person can be thinking it's just because of the aging, because of some family circumstances, life circumstances, but not because of this condition. It also can have some specific signs, for example, hair loss, losing hair on the outer part of the eyebrows. It also could be a dry skin, constipation. For women, it could be heavy periods. It also can lead, as I told you, gaining weight, depression. That's why it's very important to treat this condition. But at first we have to investigate how to find out. It's a thyroid function tests, TSH, as well as T3, T4. TSH will be high and T3, T4 will be low. And also it's also important to do antibodies tests because usually it's because of the Hashimoto thyroiditis. It's an autoimmune condition when your immune system is fighting your own thyroid gland. That's why you also have to check your antibodies. The next condition is number 6. It's endometriosis. It's a condition when the tissue inside the uterus, endometrium, it's quite normal. Everything is normal, even if it's inside the uterus. But if it's anywhere else in the body, it's not normal. Sometimes it could be on the bladder, which can cause UTI symptoms like a frequency and also pain on passing urine. Or it could be on the bowels, which can cause a painful bowel motions, constipation or diarrhea. Sometimes it also could be on just inner layer of the pelvis, which can cause a severe pain during menstruation. The average time to diagnose this condition is 7 to 10 years, and it's just because of the pain considered normal during the periods, but it shouldn't be like this. If it doesn't control by simple NSAIDs, it means that there is something else. As well as we can consider that this condition, when there is a painful intercourse, it also can lead to infertility, miscarriages, Also, there is this pain, which of course making a person disabled. For example, when there is a working day, they have to take day offs, and how to diagnose it. Sometimes specialists with just taking history can put this diagnosis and start treatment with medications. But in some cases, the gold standard considered it's a laparoscopy. So when we, with the camera, look inside the abdomen and see this abnormal lining, or sometimes it even form cysts, chocolate cysts filled with blood, and surgically remove this tissue. Number 5, Lyme disease. This is a condition caused by a bacteria, Borrelia burgdorferi, and transmitted by ticks. Can cause a really severe damage to the body, and it works quite slowly and can be really easily treated with antibiotics at early stage. When we can suspect it? At first, it could be some rash, very specific rash for this condition, but unfortunately 30% of the people don't have such rash. It also could be when you see that the person has a flu-like symptoms like a fever, chills, headache in the summertime. After these symptoms, can be some joint pains, and this joint pain again is quite specific because it's at first it could be in the knees, then the ankles, then in the wrists. So it's just in the different joints at different times. It also can lead to Bell's palsy, so the asymmetry of the face. It can lead to some heart problems, can cause a meningitis with headaches and neck stiffness. It even can cause dementia with memory loss and brain fog. There is investigations for Lyme disease. It's a two-tiering testing is with ELISA and Western blot. Unfortunately, in some cases, it could be negative, false negative, or false positive as well, because sometimes it can be positive in some other conditions, plus symptoms, which with this immediate treatment can really help these people. And also how to prevent this condition. After every bushwalking, you have to check your skin, your scalp, everything that where could be these sticks, because they have to be on your body quite for a long time, more than 35 hours, to make sure that these bacteria go to your body. Number 4 is a heart attack in a diabetic patients. In this case, usually heart attacks happens with a severe chest pain. It could be nausea, vomiting, sweating. This pain can radiate to your jaw, to your shoulder. But in a patient with diabetes, when there's a high blood sugar level damaging the nerves, it can cause that there is no any pain actually, or pain could be no so specific for heart attack. It could be just a burning pain or back pain, or it could be just some very severe fatigue and confusion. Sometimes they can even have a syncope, so loss of consciousness. And eventually, when they do ECG, they can find that they have this myocardial infarction. How we can also investigate it? They do enzymes, troponin level. If it's a high, it also can show that it's a heart attack. Number 3 is the rheumatoid arthritis. It's an autoimmune condition when your body attacks your joints, and it's quite similar to osteoarthritis, but there are also differences between these two conditions. For example, for rheumatoid arthritis, the morning stiffness will be more than 30 minutes. It's also the worst pain at the beginning of the day, not at the end of the day, like for osteoarthritis. It could be diagnosed with rheumatoid factor and anti-CCP, but unfortunately some people doesn't have positive rheumatoid factor. which can make, of course, to diagnose this condition quite difficult. Because if we start treatment with DMARDs, it's a special treatment for rheumatoid arthritis, it can lead that we suppress immune attack, which stopping this damaging of this joint and lead to remission of this condition. That's why it's very important, if you have any pain in your small joints, for example in your wrists, it's good to see a rheumatologist. They do blood tests, do X-ray for you to find any early signs of rheumatoid arthritis. The next condition is aortic dissection. This condition, when this blood, which is inside the aorta, goes to the inner layer of the wall of this aorta, and it can lead to a rupture of the aorta, which of course is a life-threatening condition, or it can lead to a blockage of the other arteries, like to the kidney, brain, or for example intestine or legs. It's a very uncommon condition, that's why it's usually misdiagnosed. It can start with chest pain, back pain, goes down to abdomen, and the pain is very severe, tearing pain. There is risk factor. It's usually high blood pressure and smoking. The gold standard to diagnose this condition is CT angiography of the aorta, which will be in the different levels, the chest level, abdomen level, and pelvis, to make sure that you can find that at which level actually the damage. And the treatment is surgery. Number 1, Parkinson's disease. It's a loss of dopamine-producing neurons in substantia nigra, which can lead to tremor at rest, bradykinesia, slow movements, and rigidity. There is a prodromal period in Parkinson's disease between the 5 to 20 years before this tremor starts, which is vivid dreams, usually violent dreams with punching and yelling, loss of smell, constipation. It's very important to treat this condition as soon as possible, because there is no, unfortunately, treatment for Parkinson's disease. The only thing that we can do is just slow it down. And if it's early treatment, it's really can make improve their quality of life, their function, mobility. So when you suspect this condition, you have to go to a neurologist. They can do some physical examination for you. They also can do some scans for you, and early treatment, as I said, it's very crucial. Thank you very much for watching this video. It was a 10 condition which can be misdiagnosed. I hope you found this interesting and helpful. Bye bye.